Bottom right hand corner of the screen here is the To Go app, effectively running on my iPad. So I tap on it, and what it's actually done is it's opened up To Go for me. It's connected to the To Go server. It's actually showing me here a list of application icons, which, as you can see, are starred. They've effectively been added to my favorites list. And the very top one of the favorites has automatically loaded in the background. So this is Excel that's actually opened, remember, back on the To Go server, not on my iPad. And as a result, I can effectively go and pick up anything I want to do here in Excel. So I could simply say, go and find me that Excel spreadsheet. And here I am working in that Excel spreadsheet, giving me the ability to effectively pick and work with any content that I wish to within the Excel spreadsheet to be able to actually get it to do what I want to do. You may not make this out very clearly, but what I'm actually doing now is going down a pick list of states, deleting some, including others. Clicking OK effectively has filtered my Excel file. So there's a very quick, very simple introduction. But if I now bring in from the left back to my navigation bar, I can now go, for example, to the applications icon and reveal that there are other applications that are actually available to me here. Some of these take a little while just to load their icons, so forgive me for a moment. But you can see that what I've actually got is the ability to go for other systems. So let's, for example, drop into Word. And here I am, it's now starting up Word. I can now open the document within Word. And I can be working within Word on my iPad, again, just the same as I would be if I was actually working on my laptop. I'm just going to step back again for a minute, pick another application. I'm going to come up and pick up ClickView as I used that in the presentation before. And here's ClickView coming and opening. And in this instance, I've actually got something that is moderately healthcare related, although it is actually US based, which is a surgical scorecard giving me various statistics about operating rooms, process times, clinical care, etc. And as you can see, what I'm able to do very directly on my device is simply pinch and zoom in and move with these tabs to be able to actually give me the information that I want to be able to access. I apologize that it's not highly clear on the camera, on the webcam, but it is actually something that I can very clearly see this on my iPad. So I can actually just go and pick up selections, choose locations, and sort of pivot the information, or do whatever I'm allowed to do within this particular application. Now remember, I'm sitting here at the present moment in ClickView, but if I come back and touch on my history icon, as I said earlier, what we build is these individual thumbnails that actually show us previous applications. So tapping back on Word immediately puts me back into Word. And that is, in its simplest, is what this is actually all about. It's either the ability to create a series of different applications that people can go and choose from. It's the ability, as I said, to be able to pop up keyboards, and you might just be able to make out that I've got a sort of standard iPad keyboard on display now. I touch a button, and what I've now got is a sophisticated keyboard that's actually got function keys and so on. I can't actually zoom in the camera, I'm afraid, here. But this is the standard UK keyboard. I touch a tab again. I'm now actually showing the process of being able to move around between the keyboards. So I can actually switch, for example, to US. We even have a Danish keyboard because we were in Denmark for some time. But the other thing that's actually here, as you may know, is there is a Siri button here on my keyboard. So we could actually touch this and dictate directly into an application. And one of the things that is specifically been raised with us is we had an emergency doctor in Bath take a look at all this, and his estimate is he could probably save between 10 and 15 minutes per patient per FCE on being able to dictate his notes rather than having to type them. When we then did some calculations to suggest, and these of course will never be the results, but if we got all the doctors, emergency doctors in the UK, in NHS England, to actually do this, we'd save the NHS about £300 million a year, simply because of the ability to actually get more patients through the system in the same amount of time. Now, clearly, there's a lot of other things that we might be able to achieve through the implementation of the technology as well. And one of those that we highlighted in the sort of blog article we did is the fact that right now, healthcare workers are fully kitted out in PPE, so they're really not very easily capable of doing lots of typing, for example, on a ward computer, because they've got to strip off their gloves in order to be able to actually work with things. They've then got to go off and wash their hands in order to put on a new pair of gloves and so on. So there's a lot of time involved in this sort of process that we could literally get rid of simply with a touch of the button that actually says, let me dictate my notes straight into the system.